Good afternoon, Hopkins, and welcome to the Thursday edition of the Hopkins Hangout Hour. I'm your host, Mike Terosian, and with me today is Jim Cousins again on Thursdays. We like hanging out with the Board of Health for some reason together. And also with us today is Tom Nappy. He'll be running in the questions from the social media. If you do have any questions or comments for us or the Board of Health, just write them in the comments section on YouTube or on Facebook or send us an email. Jim, how we doing?
Doing great. Good afternoon. Hi, Mom.
Back again here. I decided to come into the conference room today. It's been a while since I've been there, and so we're Thursday. Thursday is everything Board of Health, everything COVID, and so forth. And with us is of course Shaun McAuliffe, our director, and Kasey Mauro, our town nurse. Hi guys.
Hello. How you doing?
All right, so here we go. It's Thursday. It's been a whole week. What's new? What do we miss? What do we need to know?
Stop traveling. I think that's the key.
Yeah, didn't we hear is there a pause going on in Massachusetts now?
There's not a pause. So one of the things that I know Dr. Kavanaugh addressed yesterday is that for the school, for Hopkinton in particular, and one of the things that, so what she's recommending is that, the residents in Hopkinton that have children should, starting next week, just kind of lay low and avoid unnecessary travel, unnecessary exposure and high-risk events or activities so that we're better prepared as a community for the school reentry. And what we've seen over the last, we could say 14 days or more specifically over the last week, is that those that have not been following, the governor's guidelines and have been traveling out of state or out of country are coming back with COVID. And, we saw our risk rating go from a gray or unshaded last week up to a green. And if under a couple of fortunate circumstances, if like this one family, actually almost two families in particular, if they had different outcomes, it's conceivable we could have hit a yellow for the week. And that has serious implications on our reentry. It has potential implications on the ability to hold fall sports or winter sports. And it's time for everybody to get serious and really to, just acknowledge that, we're in a pandemic. Going to a foreign country and traveling on one or two airplanes, as my 5-year-old would say, is really a bad decision.
Now, what do we know? What can you tell us about the cases that happened in Hopkinton? Was it like airplane travel or particular states? Is there any information that you can give us?
We decided that we're going to be including like in our updates about the case numbers, like how that person came to get COVID, like what was the transmission? Like, is this person part of a group home? Is this person traveling? And so these specific individuals traveled to high-risk areas all by airplane. And even though there's rules for how, if you do go on an airplane and come back, like how you can get out of quarantine, it's still not recommended that you go to other places. Like, even though you can do that, it's meant for people that have to go to those places. So say if you have to travel somewhere for a funeral or to take care of somebody or to fulfill like something that you absolutely necessary need to do, like, sure, by all means, go and do that in the best careful way you can. But when you come back, you need to abide by these rules. It's not like, okay, you can go to California and go on a vacation and then just come on back and get a test. And it's all fine that you just went there. Like, it's still not recommended that you do that.
And the same is true, it's come up and I hate, I hate reverting back to the basketball courts, but it's the same thing. Here you had high risk activities. People were not following the governor's orders or just any of the recommended safety protocols. And, we were lucky. And, I've been joking all day that, I'm in red today. I'm a Framingham resident, and Framingham just went red. And so they are now evaluating, oh my God, all of our high school athletics, and possibly a fair number of our community athletics are now on hold until we can get our arms around everything and bring people into compliance and reduce the rate of infection in this town. And it's the same thing back in Hopkinton. I mean, we're fortunate enough to have gone or seen this problem start developing from a very low positivity rate. But it's a reminder that, again, we're still in a pandemic. Even Dr. Brown, the head epidemiologist for the state, she had a reminder on Tuesday that all towns that are in this unshaded or even green risk category are, one or two, issues away from going yellow and then falling into these more restrictive, regulatory environments. And we can't be lulled into thinking that, we're immune from all of that.
Now I don't know if there's an answer to this, but I'm interested. I'm hoping that sometime, hopefully early 2021, there may be some type of vaccine available. And seeing the way numbers are going up and numbers going down all over the place, do you think that your best advice, which you just said, is to stay home, not fly or travel to these areas? And that really echoes what Dr. Kavanaugh was saying. If people who have kids in the school system could just stay at home, it would really, really be helpful because the schools are being disinfected. So that's going to be good. So my question is, if we say, okay, that's what we have to do you think that has to be until a vaccine? Or do you think that if things were really strict and things get down to a certain level, there could be more freedom allowed?
I mean, certainly if we had overall, if we had 100% compliance, throughout the United States, we could be in a better position, but we don't have that kind of cooperation with everybody. And since there's no way to keep other people from other states out, there's no way to guarantee that cases won't happen in Massachusetts. It's just not realistic. So the first thing you would want to do to combat a communicable disease is either to have a vaccine so you can treat it, which we don't have a medicine to treat it so less people die from it, so that you're less worried about the mortality rate, which we don't have yet. So the only things that we do have is contact tracing, and contact tracing becomes ineffective once there's community spread. And so once we get to that, right now where we're green, it's green, so that seems like it's really not that bad. So I really wish they would change the colors to maybe yellow then, because that's when you really need to start pressing on the brakes and deciding, okay, I'm really going to limit my interactions with other families and seeing multiple people, because that's how contact tracing becomes ineffective. Say, if I have COVID and then I go to a party with Shaun on Saturday, and then I go to a party on Sunday with Mike, then I've given it to Shaun and I've given it to Mike. And if they feel like it's okay to see multiple people, then they're going to keep spreading it. And that's when contact tracing becomes ineffective.
Right.
So right now, when that's our only tool, we really have to limit those interactions. So when we see those colors start climbing and those cases start climbing, that's when you pull back and you start to only see people that you have to see.
Right. And people, residents in Hopkinton need to know that, there's a significant, cohort in town that appear to have, travel requirements. And I have not gone in the last 2 days, but we had seen 281 residents travel since August 8th. So that's, 281 potential exposures that those are individuals that were either on a train or an airplane, because that's where most of these forms are being submitted from. That, so they've been in a closed environment for a prolonged period of time with people passing by each other, and they've gone through, either an airport or a train station and had additional potential exposures. They probably picked up a snack or two. They may have used a restroom that tens of thousands of people are using in a day. These are all potential exposures. And if you're not, and I think what, this travel, these latest incidents of travel are showing is that, the risk is real. And that it only, the greater the distance you're traveling, the greater the risk. It's, it's a real concern. And then, as we started discussing yesterday, one of our next concerns is, let's start looking at Thanksgiving. Let's start looking at the Christmas holiday when our children are coming home from college, or our families are coming in to celebrate the holiday with us. How are we gonna, if we're not in a really good position in November, I don't know what it's going to look like. And we need to start thinking about this. And I've already had conversations with parents yesterday on, well, maybe I'll pick up this child on this date. They can stay in this room and under quarantine. These two have the ability to get tested right before they go. They're gonna drive, and then hopefully they've tested negative. They'll drive, have limited exposure, and then they won't necessarily have the same quarantine requirement as the third child we have. But again, we're in a pandemic. We need to prepare for this. If we're traveling, we need to have plans in place at home, and really we need to be mindful of the risk that's out there. And if we want our kids to be playing sports, if we want our kids to be attending school live, we have to make a commitment to getting this right. And it's not difficult. It's a mask, it's distance, and it's avoiding these high risk situations. And
Shaun, how come you never say time? You say mask and distance, and I get that, but isn't time also a consideration?
Yeah, it is, but it's, I think when I don't say time more often than not, because when I'm out in the community, like when I'm walking down the street, I'm really not having, and I'm not considering that an exposure because I don't have time. When I'm in the supermarket, and I'm distancing myself and I'm wearing a mask and I'm having little to no interactions with anybody, and against kind of some personal beliefs, I'm actually using the automatic checkout counter to limit my exposure and or contact, or to reduce the contact that I'm having with the poor person who's working at the checkout counter, because they're going through, are having hundreds of exposures a day. Like time, I'm not having that contact time. But if I'm on an airplane, I've got hours of contact time.
And not only that, you have hours of contact time in a confined environment, because indoor versus outdoor, that's a big difference too, right?
Right.
Yeah.
So it's but it's.
I think you mentioned those things because those are the most important things, right? So if we spend 12 minutes outside, but you sneeze in my face, does that mean that it's okay because it was 12 minutes?
Right.
So the other stuff's a little bit more important. So if you were 6 feet away from someone and you were wearing a mask and you spent a half an hour with them, like I'd pick that scenario versus spending 3 seconds with you and having you sneeze on me. So
right.
And
You
I
try
think we discussed this.
it there. So you got to use like a little bit of like critical thinking, like, because we spent less than 15 minutes, does that mean that I'm in a better scenario than if I spent a half an hour with you with a mask on? Probably not, because direct secretion, like direct contact with your secretions would, like, that's it, I'm done for. So
Right. And that was why I was kind of asking, Kasey, because it's interesting. If you had to, just what you said, if you had to prioritize those, probably masks is number one from what I'm hearing.
yeah.
Then 6 feet or more is number two. And then, I don't know, would indoors, outdoors, would that be probably pretty high?
Like for me, like I would say like masks, and then hygiene, distancing, and then if like your environment, so indoor, outdoor, and then like the very last maybe time, and then indoor, outdoor,
Okay.
So that'd probably be like my last category, right? So coronavirus doesn't know you're outside, don't do it. It doesn't know the difference between inside and outside. Certainly the air exchange is very different inside a building versus being outside in fresh air, but like just because you're outside doesn't mean like COVID doesn't get you. It's like all that other stuff adds up to how well you're going to limit your ability to catch it or transmit it to somebody else.
Yeah.
And I just wanted to jump in here. We got an email and a comment from one of our viewers, from a Jennifer. And the comment is, I want to commend and thank Shaun McAuliffe on the decision to close the basketball courts. I understand there has been a lot of negative feedback, but I really appreciate that he took this action to ensure the health and safety of the community. And then the question is, can you talk a bit about the recent cases in Hopkinton, which you kind of already did, but also there appears to be an uptick in cases in surrounding towns in the Metro West. Most concerning is Framingham. That is now read on the weekly public health dashboard. Is there a coordinated effort between towns to evaluate the risk to the region and what is driving these case increases?
So we were all of the local health directors. So first off, we all participate in 2 state calls each week. And then there's a group of us that are part of, so, we're part of a tobacco coalition. We're part of an anti-vaping coalition. We share a lot of resources. So we are in frequent, if not weekly, contact about what we're doing to help control the spread. I, as a Framingham resident, I'm in frequent contact with the director in Framingham, and he's doing everything he can. Okay, we're doing everything we can to control the exposure there. They brought in the testing. They're really cracking down on these large scale events that are taking place. There's they brought up, there's been a recent auto, like a weekly auto show that would attract 300 to 400 people, and no one was, wearing masks or distancing. So they're going in and they're going to start utilizing the governor's, the state police and the ABCC task force to start addressing that. But that said, this gets to this whole point where, we're not an island and we're not walled off. We have residents from, all over the area and all over this, from other states that work in Hopkinton. And these residents from outside of Hopkinton, they're working, they're purchasing, they're purchasing meals, they're purchasing gas, they're all potential exposure points. And that's why, wearing a mask and distancing when you're out and about is important, because it's going to be our best way to control that risk that's coming from outside of the community.
And we also had another question sent in to us from John. He asked, had a test at a pop-up site in Milford last week, but he hasn't heard back yet. How long do these tests typically take to hear back from?
Well, it depends on like who performed the test. Typically, when you go get a test on it, they tell you how long it will be. Um, some of like the state-sponsored ones are returning most of their results within 72 hours. If he hasn't heard something, I would encourage him to call the place where he got the test done. We won't be able to answer exactly if they're using one of the bigger commercial labs. Like those results are sometimes taking 8, 9, 10 days. Massachusetts is moving towards making sure that we are processing our own labs here so that we're able to get quicker answers. But there are still some facilities that will send their results out to those big commercial labs, which are all clogged with every other state.
I was
And
wondering, actually, hold on a second. I want to follow up since we're talking about testing for a minute here. Have you heard anything about potentially like a new test that's about the size of a credit card that I think is supposed to be, doesn't need a swab or something like that? I was just reading about it the other day, and I didn't know if it was just kind of like a potential thing or if it's been you guys been notified that it might be something in the pipeline that's coming around.
I mean, they're constantly talking about different tests that will come to market, right? Every test maker is trying to make the next test that's more accurate, easier to deliver. That can be a point of care test that like a laboratory doesn't have to do, and like send off to, so you're not waiting for those long results. But I haven't heard of anything new that's come to the market yet. I know they're trying to push more moving towards like saliva testing, but I haven't heard of like a new system yet.
Are the prices coming down at all, or is it just still too early?
So the pricing, like when you go and get a test,
Yeah, isn't it like $30?
it depends on where you go and what test you're getting, right? So there's different types of testing. There's a PCR test, which is like the gold standard, and then there's antigen testing and antibody testing. And so antibody testing isn't covered by insurance at this time, but it also depends on how they bill it. Sometimes you can get it covered, sometimes you can't. Like all this stuff is new and the medical billing isn't straightforward. I was going to compile a list of places that are close to us that kind of outline just in a little bit more easier detail. I had a resident comment that it was a little bit too difficult for them to use the state map. It was too hard for them. So if I typed it out, maybe this will make it a little bit easier. But you can get a PCR test done at the ARC Labs in Southborough, and I believe it's about $140. You can go get the same PCR test at this Stop the Spread site, and it costs nothing. So it just depends on where you go.
But and then one of the things is that it's making sure we want either we or your primary care physician should be part of the decision, because you want to make sure that you're asking, or at least that you're having a good conversation with the facility that you're going to get tested. I mean, we will always recommend that you get a PCR test, because that is what they always say is the gold standard. But if you are, if you're going to get an antibody test at the time that you think you're first becoming ill, that's not going to help, because that's not going to let you know if you're infectious right now or if you're sick right now. There's this, and that's one of the things that even today I had to go and double check the type of test that was run on an individual, because for an instant I thought, oh, actually they had got something like an antigen test or an antibody test when a PCR or an antigen test would have been more appropriate.
So I want to ask you now, where we're talking about the testing, is CDC just came out, was it yesterday, day before yesterday, that you don't need a test if you don't have any of the symptoms?
So I really, so why would they say that? Like, so why would they all of a sudden say this? And so, I mean, if you remember back to March when our supplies for testing were very limited, and it was difficult to obtain a test, like they're more or less saying like, let's not waste tests. Like not if you're
Right.
like if you are asymptomatic and you had contact, it's okay to be tested for that reason. But if you're asymptomatic, haven't left your house in 14 days, haven't had any sick contact, nobody in your house is sick, there's no reason to otherwise to believe that you would be ill. Like you just don't go get a COVID test, you know? So like let's not waste those. Keep acknowledging that like these are limited resources that, you know, going into flu season, it's going to be important to be able to differentiate like, is this a flu or is it COVID or is it both? You know, but if we just have everybody getting a test without any reason to really need that test, then we're gonna be in the same situation we were in March where we didn't have enough for the people that needed them.
Right. And that's what's basically fun. And we're getting into, like you said, the flu season, and you need to know the difference. And I mean, can you tell the difference? I mean, is it the testing is what tells you the difference exactly which flu you have, whether it's the COVID or?
So when you get when you get a flu test, you can either get a rapid test or you can get like a regular test done that gets sent off to a lab. And so, you know, on like the trying to think of it, the stick, right? It kind of looks like a pregnancy test. There'll be a line next to A, B, so you know what type of flu that you have.
Okay.
And then the COVID test is similar, but it's not like A, B. It doesn't pick up strains. It's just either false or negative.
Okay.
What are
So-
you? Oh, go ahead, Mike. Sorry.
No, go ahead, Jim.
I'm just wondering, you know, talking about flu season, are you expecting this to be a nightmare with people like maybe having flu, maybe having like a bad cold, thinking it's flu, and then that's in this whole mix of worrying about COVID-19?
I'm hoping that everybody goes out and gets a flu shot. I mean, the better we prepare. You know, you don't go on a long trip with with a pair of socks and, you know, one shirt and forget everything else at home. You prepare. What do I'm going to need? Where am I going to go? Is the dress appropriate? It's the same principle. It's all right. We know that we're in a pandemic. Flu is one of these confounding issues that I should probably prepare because I don't want the flu. And Lord knows, I don't want to get the flu and maybe have to go to the doctor's office or the hospital if we're seeing an uptick in cases and run the risk of getting, COVID on top of that.
The reality is that most hospitals could not be able to simultaneously deal with a bad flu season and COVID. There's
Right.
limited number of vents in a hospital. Like they don't get to just make more. We saw what that looks like.
Yeah.
It's not easy to find them when everyone else is looking for them too. You know, so they don't get to just pull these resources out of nowhere. So they're trying to prevent a bad flu season with COVID because they realistically cannot handle both. So they're asking you to get your flu shot done so that we can not overload our resources.
And
Right.
on a positive note, if people are distanced, if they're wearing a face covering, if they're practicing good, if they have good hygienic practices, they shouldn't contract the flu, COVID, norovirus, just common colds. Like, so it's one of these things where it could be, if we're all doing what we're supposed to, we could have a really good year. I was just talking to the chief yesterday. This is the best rate of attendance that he's ever had. His absenteeism is almost non-existent, and it's because someone else had something happen to them. And he's like, this is just fantastic. And I said, but it's all related to the fact that people are doing what they're supposed to be. They're staying home when they're sick, and they've got good practices in the workplace and at home, and that the people that they live with and share spaces with are all practicing those same, behaviors, and it's showing results. And again, and that's what sometimes drives us so nuts, is that this isn't hard. It's if we just practice it, you know, like, if we just practice it, we're gonna at least see a better outcome. So, like, what's the argument against not wearing a mask, or not distancing from someone? I don't see a downside.
Yeah, I'm with you on that 100%. I believe in the flu shot every year, even though one time I got it, I did get the flu. But that's going to happen, and but look at all the other times I didn't get the flu. I mean, what's it hurt? What's it cost? It's nothing.
Oh,
Get it done. Yeah, get it done. Insurance takes care of it. If not, then the state takes care of it. So I mean, just get it done. And I don't want to get on that horse again about hey, we eliminated polio once, and now look what's back because no one wants to get vaccinated. Here we are, we're dealing with corona. Now we're going to be dealing with regular influenza. The evenings are the darkness is coming sooner. Thank goodness we've had the summer we've had to kill those mosquitoes.
Right.
But we still have Triple E. We still have West Nile. We've gone down 6 months. 6 months been like this. What's a little longer? Keep it going. We're almost out of it. Let's get out of it. Maybe we'll see what the normal was before. Maybe we'll be back to that someday.
But and then like from a personal, just from earlier this week, I mean, Kasey definitely doesn't want to be making those calls, those real hard calls to people where, I look over at Kasey and say, I can hear him crying. Do we want to make the calls to the rest of the family? And then, these are the things that you don't want to personally experience some of these, or be part of some of these conversations we're having that, it's just, they're not, in Hopkinton, these are rare occasions, but to the families that get sick and see the potential spread through the family or their network of friends, this is just really, it's devastating. And again, it's preventable, and we know what we have to do to prevent it. I'll say I've started to get, some thanks for taking down the hoops and for some of the other stuff that we're putting in place. But, it's if we're not kind of towing the line, we're just setting us up for a negative outcome.
All right. So talking about basketball, we'll talk a little bit about sports. Is the MIAA, is the Hopkins school system and everything doing everything right by allowing some sports to happen, some not to happen? Do you feel that we should be playing sports?
I had a very long conference call today about that very topic. I believe they have a comprehensive program that they're going to announce, I think the beginning of next week. But yes, they are. They have looked at the DPH recommendations, the limited recommendations coming out of DESE, out of the Executive Office of Environmental Affairs, and from MIAA themselves. And they put together a strategy that reduces risk across the board, that provides contact tracing, that limits the amount of exposure between communities. It is a comprehensive plan, and at present, I don't have any. I didn't have any comments this morning because the athletic director did a really good job
And
putting
speaking of
together this
which,
draft.
Rich Cormier, athletic director, will be on tomorrow with Tom Nappy at 2:00. And if you have any questions for him about what's going to look like for your son or daughter to play sports this fall or even at all this year, send us an email, give us a comment on YouTube and Facebook. So I feel, everyone should be doing everything they can if they want to get back to the office and get back to school, get the kids back to school, get things somewhat normal, get places opened up again. We're still, everybody for the most part wants to do it the right way. And, if they stick to it, things could be faster. What's the word? What's the latest word on the vaccination going on? Are they, at human testing? Are they at, any idea where they're at with that?
Last time I read about it, which was sometime last week, they were in phase 2 of human trials. So like phase 1 is a very small group of people. I think it's about, I don't know, 100 or something. Like it's a very, very small number. And then they test to see like how well the vaccine did, which it did really well. So that's why it passed to phase 2. And so phase 2 requires, I think, 30,000 volunteers. So it's a much larger group. Vaccines typically take years and years and years to do. So
Right.
I think they just went to phase 2 at the beginning of August. So it's going to be some time until we hear like the next part. But so they're in phase 2, which is that large group of when they're testing this vaccine on a large amount of people to see if it creates the same results they saw in that small batch.
Excellent. And so yeah, like you said, everything's been fast tracked for it, and which, it could be a good thing, could be a bad thing. I don't know. It is like, was it 3 major companies that are?
No, I think there's 30, right?
30 companies.
30 different vaccines that are in
3 that are in phase
various stages of trial. And then I think, what did you say, 3 that are in advanced?
3 that are in phase 2, right?
Maybe that's what I was thinking, was where I got the 3 from. Okay, so we still have to get our flu shots, and I want you, Kasey, another chance to you to plug your clinics coming up. So tell us about these clinics.
So I sent out all my messages to like my medical supplier to just double check and see when my vaccines are going to be in. I haven't gotten an answer yet, but because of the COVID-19 testing event that we did, like I'm confident we'll find out our vaccines are going to come on a certain day, and then we'll be able to set up those clinics right away and have them run without any issues. So we will announce dates as soon as I know when the vaccines will arrive. I am planning on doing multiple dates. We will be able to vaccinate children of all ages. Which is really helpful. A lot of the places, like if you want to go to CVS, it's children 9 or older, or you have to go to your pediatrician's office, or your pediatrician may not offer the nasal flu, which we're going to offer some limited options, knowing that some flu vaccine is better than nothing. We'll have those also. All the vaccines that I ordered are all preservative free. So as soon as we have just a date for when our vaccines are going to be in, we'll start releasing the information on how you would register, set an appointment, and then show up to the drive up.
Fantastic. Can't wait for that to start. And speaking about can't wait, here's Tom, who's busting in with some more questions.
That's right. So we got a question asking about canceling school sports. And I guess the question is, obviously, in charge of making the plan for the sports is mostly the coaches, players, or coaches and management, stuff like that. But as far as like canceling the games, is there a certain limit, I guess, to where you would say, okay, we have to cancel sports, it's not working? For example, would it be like if one person tested positive, or if 2 people tested positive? I guess, is there a limit of the amount of positive tests as far as canceling sports?
It's based on the color metric. If you're red, you're done. And then it's a case by case. These are the discussions that we've been having, both internally with different programs that are unrelated to school. It's what is your case load in the community? And is it, if we get 10 illnesses at a at a say at EMC, does that really have any impact on sports in town? Well, not if they're not residents, not if they don't have children. So there's a lot that we need to take into. Okay, we need to take these different external and internal factors into consideration. But at present, Hopkinton's doing well, and then this kind of gets to the why we were so critical of what was going on at with the basketball courts, because we saw that it wasn't just Hopkinton children, Hopkinton college kids, and Hopkinton adults. They were from everywhere, and it's, again, you're just increasing the risk. It would have been different if everybody was wearing masks and they were making some modifications to the way they were playing, but they weren't. And so we're working with all of our different athletics. I mean, I've already had multiple meetings with Parks and Rec about what we're going to be able to bring or introduce through the Parks and Rec program for fall programming. And we have coaches evaluating how they can modify their play to accommodate both the EEA regulations, how they need to become well versed so that they can self-certify, that they can provide this athletic opportunity in a safe and controlled manner. And then some of it, again, it's educating the parents that are spectating to do the right thing, or the kids that are spectating to do the right thing. But we're having multiple conversations at the end of the day to make sure that we can bring back some level of athletics, but those that we bring back, we're going to do so safely.
Yeah, I think as soon as we start to see transmission, like community transmission, so say if one player gets it, gives it to another player, that's like a time to press the pause button. If like it transmits from like a student to another classroom, like that's a time to stop. If there was just like a single case that was on the team, but then no one on that team got it, like that's not a reason to stop. As long as we can trace back where that person got it from. Like if they brought it from home and then brought it into the school but didn't transmit to anybody, that's a very different situation versus having two people test positive on a team.
We had a couple cases over the summer where, in one instance there was a positive umpire, but we were able to look at photographs and in one case a short video that demonstrated that the umpire was off with a mask so looking at the pitcher to the rear left of the pitcher, 6 feet away, and then in that instance, a couple of the players actually went and got tested, and because they were distanced, because they were wearing masks, we didn't see any exposure outside of that one individual that was identified as a case. And it's so, as Kasey said, it's we're going to be looking for transmission within teams, between teams, and but then again, if we're keeping our kids home when they're sick, it takes some planning and the establishment of processes to make sure that that we're not letting, I as a parent, I can't go to work sick. I can't condone my wife going to work sick. I can't send my kids to school sick. In the school that my kids go to, if I actually send my kids to school sick, there's a good chance I'm going to be looking for another school. And that's the way, that's their protocol. But we've been talking about this. It all starts at home. I mean, we need to put these practices and procedures in place. We need to model good behavior. And then one of the things that Kasey identified was this, this promise that we're going to roll out. You want to talk about that a bit? Or
Sure, yeah.
why don't we
So
take over now?
I don't have it verbatim written in front of me, but basically, like, I think that we're in a rough place now where I wish we were in the beginning of COVID. Like, we're back to the surge where people were just so concerned about COVID that their initial reaction was to help or offer something to the person next to them because they just felt like so awful that we were all in this situation and we're all in it together and we're trying to help each other get through it. And now that we're 6 months in, like, we're so over the pandemic, like we couldn't be more over it and aggravated and just have this chronic stress in our life where things that used to be very predictable, like the beginning of the school year or summer, like expecting that you're going to have a nice summer vacation, like those things that we looked forward to and would bring down those stress levels, like no longer exist. So we're all currently tapped out, So part of the Hopkinton Promise that we put together is, first of all, just acknowledging that we are all trying our very best. This is new. What I say to you today may not be true tomorrow. And just acknowledging that if we see something that looks not right to us, like, let's just talk about it in a way that is civil and respectful to the rest of the people that are in town. So we're just committing that we're all going to try to behave in a way that is for the health and safety of individuals in the town who work here, live here, everybody that's in it. And the second part they talked a little bit about earlier in the week is just supporting those small businesses that are within the town that, if you thought it was hard on you, like, just imagine what it's like where they got all these new protocols. Now, not only are you a chef, but you're also a nurse, so they're asking these huge things of these small businesses. So just trying to support them in a way, so those businesses can survive, because a lot of those people have put their blood, sweat, and tears into it. And, before COVID, we really appreciated them, and we should just go back to showing that we do appreciate them now, even in these difficult times. The third one is escaping my mind right now. The fourth one is talking about societal issues that we may have different opinions on, and just doing it in, like, bringing those ideas up in a respectful, civil way. So we don't have to have the same ideas. Matter of fact, I'm happy that we don't. That way we can have conversations and learn. If we all thought the same way, we would never progress. So it's important that we talk about differences, but that we do it in a way that's open and not disrespectful. And just kind of getting the community back to where it was. Hopkinton is such a nice town to live in. Oh, the third one I just remembered is making sure that everyone feels included. I have read a couple of the different Instagram accounts that are in town, and, like, it's unfortunate that students feel this way at school, or that community members feel this way when they go to a store, or like a small business owner was, like, berated by somebody. Like, it's unfortunate that people that live here, work here, want to be a part of this community don't feel like they belong. And that's not how we are. Like, this is all just stress. So we all just need to reel it back in and remember, like, who we are, and just promise to be those same people we were before COVID. People that care, people that are kind, people that will go the extra mile for another person.
Yeah.
Yeah, it's outstanding.
One of the other questions we got sent in, I know you covered this a bit already, but what is the policy for keeping school children home when they have a cold? Will there be guidance issued to the town?
So if a child has symptoms, like it depends on the symptoms, right? So there's 100% exclusionary criteria would be cough, fever, shortness of breath. If your child has any of those, that alone would require them to stay out of school. And so this is a new cough. It's not a cough that they always have because they're an asthmatic. They've had it all their life, and it's just a clearing their throat. It's nothing that's new. So it's a new cough that would require them to stay out. And then the other symptoms like sore throat, nausea, vomiting, diarrhea, those other things usually require that there's two. So if they had other two symptoms, that would be enough reason to keep your child home. However, they may return to school on different scenarios. If you get your child a COVID test and it comes out negative, but they test positive for strep, the child can return home when it's appropriate, so 24 hours after their antibiotics started. If your child gets tested and they test positive for COVID, they would not be able to return to school 10 days from when their symptom onset was. If you don't get your child tested, then your child would not be able to return to school for 10 days from their symptom onset, provided that their temperature they haven't had a fever on that last day, so day 9, no temperature at all without the use of fever reducing medication. So, I mean, there is an acceptable level, right? We're talking about new coughs. We're not talking about a clear runny nose that is during allergy season. We know that kids are going to have runny noses and might cough and might sneeze. We can't assume that every time they do that it's COVID. You know, we're just going to use our sane minds to use some critical thinking and deal with it.
Right.
Hey, you gotta, oh, good.
I was just going to say, but this isn't really a new concept, because in theory, if your child might have norovirus, if they might have had the flu, if they might have strep throat, there's a whole host of illnesses that we should be keeping our kids home from school with. And if nothing else, maybe the only, if one could say that something good might come out of COVID, is that it's refocusing us on the importance of staying home when we're sick. I had an example about a month ago where, no, I just have strep throat. I'm like, well, you're not going to work because you have strep throat and no one else in the workplace wants strep throat. That's why you have sick time. But no, I don't want to see you there. And then it was like, oh, and I'm having this discussion with the boss. I'm like, do you want strep throat? Well, of course not. I'm like, but then why would you want to bring someone in that has a documented case of strep? And
that's a real cultural problem, though, right?
Come on. It is, but that's this, and there is a larger cultural problem that just feeds into this. But we, again, if we're all taking some time, like this might be the best time, because they're just saying that over 50% of the Boston workforce is probably going to be staying home in the suburbs. So we should see less illness throughout the state, because people should be staying home. But again, it starts at home. It starts with a commitment to your family, first, I guess, to yourself, first and foremost to yourself. I'm going to do everything I can to keep myself healthy. And if I'm doing that and I'm modeling that behavior, I'm hoping it's going to run off to my children and my spouse and our, other outside family members. And then again, neighborhood, community, we should, in theory, have just a healthier community if we're all, focusing on this and practicing it together. And then if we're not, it's our fault. There's nothing that Kasey and I are going to be able to do to correct it if everybody just throws their hands up and runs off abroad and isn't wearing a mask and isn't honoring distancing when they're picking up, an order from, a retail facility.
So real quick, we have just just about 4 minutes left. And you talk about how you're on your state agency calls a couple times a week. And I noticed looking at the DPH COVID dashboard, Chelsea, Lynn, Revere, Everett are all in the red. That's neighboring cities, all in the red. Are they saying why the uptick? Are they doing anything? Have they allowed something to go on that caused them all to go red? And is it something that we need to keep an eye on out here?
So I think the first thing to notice is like is to differentiate between like the different towns and how people live. So if there's more like generational shared housing, like if you have a ton of family members in one apartment, like that obviously is going to increase your numbers. Also, if kids are playing basketball in like a community setting without wearing masks and without distancing, you're going to have those larger numbers. As you get into the red like that, the community tracing, our only tool, becomes less and less and less effective. So like I'm not surprised that it went from one town to the next, because that means that people were just moving and they couldn't keep up with it with their contact tracing. So it's really not a surprise.
Okay. So it's nothing out of the ordinary. It's just because everyone is in tight quarters.
Well, I mean, and you look at Framingham. I mean, and I would argue that, well, I mean, Framingham has, there's a significant number of residents that live in close contact, were commuting to and from work.
Mhm.
You've got I just spent time with a Japanese family that this, I mean, I think there are 3 generations living in the household. They run a family-owned business. There's, they're struggling with how do we isolate the senior members in the family from the children, but acknowledging the fact that they can't have the children in the workplace, and it's this constant battle. And when if the senior members have to go off to a doctor's appointment, then people are bringing in outside, people from outside their immediate family nucleus, and that's where infection can be introduced. And it's this is just these kind of cultural and neighborhood issues that the virus thrives on. There's a big story in NPR and a focus on what's happening in a specific county or a specific part of Marin, California, where it's one of the wealthiest communities in California, well, actually in the country. But there's a neighborhood that has high density living, a lot of young people. People tend to eat out all the time. They tend to be very active out of doors in big settings, and that's all helped to contribute to the amount of illness in the community.
Gotcha. Well, that is all the time we do have for today. I appreciate that. One more question came in, but we don't have time for it. We'll get to that next week. And just a little task for the both of you. Let's have some happy, fun stuff to talk about next time.
We're trying to
Triple E isn't a big deal this year.
That's right. Triple E is not a big deal. Yes, we'll talk about
Or
that.
not in Hopkinton.
At least in our town. And then maybe we'll talk a little West Nile too. And so maybe ticks. We need to talk more about ticks.
How many cases did we get yesterday? 3?
All right, that's it. All right. So anyways, we're all done. Everyone, thank you for joining. Watch us again tomorrow when we talk to the Hopkinton Athletic Director, Rich Corbier. Have a great day.
All right. Bye-bye.